Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have a unique and in-depth show for you tonight. We're talking about the St. Luke's Simulation Center, how it's used to bring doctors, nurses, EMS students, and the community together through training and education to provide better health care. We'll be joined by a panel of professionals in this field, hearing stories of success and taking questions from our viewers. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at simulation training with St. Luke's University Health Network. Stay tuned. Meet Megan Augustine. Megan is the director of St. Luke's Simulation Center. Megan received a bachelor's degree from East Stroudsburg University and a master's of education at Kutztown University. Megan oversees the planning, implementation, and evaluation of simulation-based educational programs for medical students, residents, attending physicians, nursing staff, and allied health professionals. Megan joined the St. Luke's team in 2014 as a simulation technician and became director of the center in 2016.
My name is Megan Augustine. I'm the director of the Network Simulation Center at St. Luke's University Health Network. In terms of my roles, I do a little bit of everything. I like to get my hands dirty, literally sometimes, whether that's running a simulation or help planning the simulations with the faculty, physicians, and the nurses, or troubleshooting or building some of the task trainers that we use on a regular basis. Our Simulation Center is, at its core, a training facility for anybody in the network. It's a place where learners, users in the network can come and practice their skills without having to practice on patients and potentially hurt that patient. But most importantly, it's a safe environment. We tell them that they're going to make mistakes. We expect the mistakes, but of course, we'd rather those mistakes happen here than across the street with a patient. I have fun at my job, and I truly come to my job and I absolutely love what I do. You know, I get to do the art, I get to do the technology, I get to work with people. All those little tiny moments just make it worthwhile coming here and working. It's just the best job in the world. It truly is.
Megan, great to have you here. For people who don't know, what is the St. Luke's Simulation Center?
That's a great question. So at the very core and the simplest form, it is a safe environment where learners of any type can come and practice their skills, learn new skills. But we really do put an emphasis on that safe environment. While we don't want mistakes to happen, we expect the mistakes to happen, and we're glad that they happen in our environment so that they can, have those sessions, talk about those sessions. We can talk about it more in detail, but have those debriefs afterwards and talk about what worked well, what didn't go so well, and what we can do differently so that we can take what we've learned and then apply it into practice.
It's a very transparent and open learning environment, so we're excited to see more of it in tonight's show.
Fantastic.
Thanks for being here.
Sure, thank you.
Joining our panel next is Sandy Messick, the director of the St. Luke's School of Nursing, the oldest continually operating nursing school in the country. She holds a Bachelor of Science degree in psychology from Penn State University, a Bachelor of Science degree from Barry University in Miami Shores, Florida, and a Master's in Nursing from the University of Miami with a specialty in nurse midwifery. Messick first joined St. Luke's School of Nursing as a nursing instructor in maternal newborn nursing and also provided gynecological and prenatal care at the St. Luke's Women's Clinic before being named the director of the School of Nursing in 2004.
My name is Sandra Messick, and I'm director of St. Luke's School of Nursing. I am certified as a nurse midwife and have the master's in nursing. I was born at St. Luke's Hospital, and I'm proud to be back. Nursing has been using simulation in rudimentary forms for over 100 years. What's improved over the years is what these mannequins can do. They breathe, they talk, they have vital signs, and so we keep incorporating these new changes as nursing care becomes more complex. The Simulation Center helps patients because learners can make mistakes in a safe environment in which no one is harmed. and they can see situations in clinical practice that they would not see on a day-to-day basis. Things keep changing, so we have to keep changing with it. I love working for St. Luke's. It's one of the finest institutions that I've been privileged to work with. St. Luke's supports nursing, St. Luke's supports education on all levels, and I'm just so proud to be a part of that and to educate our future nurses.
Wow, Sandy, it's so exciting. The oldest continually operating nursing school in the country. Tell me a little bit about the School of Nursing and its role at St. Luke's and our community.
St. Luke's was founded in 1884, and the first class had 9 students in it. And from that humble beginning, since then, we've had over 4,500 students graduate from the program and taken jobs throughout the Lehigh Valley, throughout the whole United States. They've served in the military and in leadership positions throughout the country.
It's really exciting to see how the nursing program has not only grown over the years, but has remained committed to St. Luke's and our community. So thank you for being here.
My pleasure.
Let's meet our final panelist, John Gillard, the Vice Chairman of Advanced Practice and the Critical Care Practice Administrator at St. Luke's. John earned his master's degree in Physician Assistant Studies at DeSales University and has continued to grow clinically and professionally at St. Luke's over the past 16 years. He enjoys caring for patients and working with some of the best physicians, advanced practitioners, and nurses in the country. For the past 6 years, John's team has collaborated with the St. Luke's leadership team to help develop and implement a team-based critical care delivery model that ensures critical care patients across the network receive the highest level of care, focusing on quality and patient experience.
I knew I wanted to get into medicine in college. I knew I wanted to be able to apply the sciences to helping people. In critical care, obviously you don't want to practice or sort of work on somebody in a critical situation for the first time. The SIM Center is a place where, from a procedural perspective or from ability to run a code with multiple team members, to being able to have discussions with families and their loved ones about some really difficult topics, such as end of life and how aggressive we want to be in regards to caring for them and delivering the care that they want. SIM Center is an asset because of the ability for us to continue to get better at what we do. St. Luke's is filled with some of the best trained providers in the country that have the right attitude and want to work together. They come to work every day trying to achieve their best, directly correlates over to patients getting the best care possible by a group of providers that really care.
John, thanks so much for being here. So tell me a little bit, how has your education in the Simulation Center really helped strengthen your approach to patients?
So the Simulation Center has allowed an opportunity for all the team members of the critical care group to work together to better their skills. We all come from many different professions and arenas from across the country, and we join at St. Luke's to provide critical care at the highest level of care. To do this, we have to have our nurses, our physicians, our advanced practitioners, our pharmacists, our respiratory therapists all work together to make sure that they have everything they need and they're collaborating, so when the seconds count and somebody is critically ill, we come through and deliver the care we need to.
Well, thank you all for giving us a little bit of a better understanding on the Simulation Center and how it is influencing all of these different departments around St. Luke's. But we're not done yet. Coming up, we're going to dig deeper into who can use the center and for what. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
The simulation lab started with the medical school. We needed that because it's the new way to train medical students. It prepares them for when they go across the street to the hospital and interact with real patients. It reassures them, gives them a little more confidence. Residents and attendings can practice doing procedures, so they're there for when the emergency comes up and they have to act quickly. They basically are prepared. We couldn't exist without it. It's a requirement of medical education that you have a simulation lab. Patient satisfaction has become very important. This helps to ensure that our patients are treated in a professional manner. I look at it actually as a quadruple win. It's a win for St. Luke's, it's a win for the communities that we serve, it's a win for Temple, and it's a win for our medical students because they get to learn medicine in a high volume, high quality institution that is learner centric. It's a nurturing environment here.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo and this is Health Now. We want to thank our audience for being with us today and providing us with questions which we'll get to later in the show. Joining me is an important panel of medical professionals, Megan Augustine, Sandy Messick, and John Gillard. We've started to discuss the basics of the St. Luke's Simulation Center. Now let's get a better understanding of who uses the center and what they can access there. So Megan, I'm going to start with you. Who has access to the Simulation Center and what are they learning when they're in there actually practically hands-on?
Sure. Anyone has access. We want it to be available to anybody, St. Luke's employees, clinical, non-clinical, med students, nursing students. What do we want them to learn and what do we want them to do? We want them to improve their skills. We want it to be an environment that they can practice their skills, they can try new skills. In the Sim Center, in all of our Sim Centers across the network, we have AV recording devices. So we have the ability to record, whether it's a simulation session or whether it's a skill session. So we have the opportunity to record those sessions and then we can review them currently, right immediately following that session, or we can send it to them online in a secure site and watch it afterwards.
Which is pretty impressive, sort of like you would watch game film before the big game.
Sure.
You're actually watching the footage of the procedures that you were learning in the sim lab.
Absolutely.
Fascinating. Sandy, how about for you? Why do you think it's important for the nursing students to have access to this kind of learning and technology?
We think that simulation is so important we incorporate it for every nursing course and every student. It's a way in which students can learn in a safe, controlled environment. They treat it as an actual patient encounter, and as Megan said earlier, they can debrief afterwards, learn from their mistakes, learn what their strengths are, and go on from there.
I would think that that would be a huge asset to anyone in the medical field. And John, for you, why do you think that it's important to be able to practice in the Simulation Center before you're in a real-life critical care situation?
That's a great question. Medicine has evolved over the last several years to be really team-based, patient-focused, and there's multiple team members that are required to deliver the best care possible. So getting the team members to work together in the simulation environment allows the group to sort of refine their skills, collaborate, learn to work together, not just as providers where they're performing procedures, but when they need to communicate with each other on what needs to be done in a time-sensitive manner.
It's a really important point because I think we often think that the simulation lab is for a particular procedure, but in reality you're talking about teamwork and so many other things that happen in a medical environment that's really important to patient care. So Megan, what are you seeing there as the models and the prosthesis? What are those allowing people to learn?
When we were looking at education as a whole across the network and how simulation can help and how we can help benefit the process, the training ratio was a big thing that we wanted to help fix. We had these great task trainers, these great models that we can use, but our ratio was very large, whether it was a 10-to-1 ratio. So one of the things that we thought we can do is build our own task trainers. And so we can help get that training ratio down to maybe a 3-to-1 or 2-to-1. So in that environment, which is very much a hands-on environment, simulation is not for lectures. It's not a lecture room environment. And we want it to be hands-on and the use of the skills. So we created our own models. And one of the benefits of that is that we get to work with, Sandy and John and everybody else in the network, and we get that immediate feedback. What would you like it to be? Thoracentesis models, knee injection models, aspiration models, et cetera, suture pads, injection pads. And I guess one of the best examples is if you have an IV arm, it costs close to $1,000, and you can only have so many of those. But if we create injection pads, and we not only use it for the education, for the nurses, but then we can also use it for patient education. Maybe that mom who finds out that her son has diabetes and now she has to give insulin to, her son for the first time. You know, back in the day, the mom was actually giving the insulin to her son for the first time. So one of the ways that we can do it is giving them these injection pads so that they can practice on the pad versus, you know, their son or daughter or their loved one. So that's just one of so many examples where we're able to not just improve the education within the network, but also expand it to patient education.
It's an amazing opportunity for people to get hands-on experience, like you said, without actually ever having to touch the patient, without that experience. Sandy, how have you seen that be a benefit to your nursing students over the years, now that the Simulation Center is so accessible to them? How is it translated into their careers in patient care?
Our nurses, I think, our nursing students graduate and they're able to hit the ground running. They've seen scenarios that they normally wouldn't experience on a typical day on the clinical unit. We can set up scenarios where they're in emergency situations and have to respond appropriately. It gives them a level of confidence when they're finally set loose to give nursing care as a professional registered nurse, that they can handle situations that arise.
Very insightful information, and we are not done yet. After the break, we're going to learn more about the technology that the Simulation Center utilizes. You're watching St. Luke's Health Now. Stay tuned.
I am so excited because being here with the surgery residents that have taught me, I'm just so excited to be working with the people who inspired me to go into surgery.
So this week is our last week of medical school. Right now we're doing Night on Call, which simulates what it's going to be like next year when we're actually residents. We do simulations like what we're going to do now, where we're called to an emergency at a patient's bedside, and we've just finished some task training, putting in IVs, doing ABGs, and blood draws. Hello, Mr. Black. Tell me what's going on. I hear you're coughing and you're having shortness of breath.
I can't breathe.
Okay. Let's get some oxygen on him. And then can you have a tube ready? Thank you. I'll rub the bag down first.
And then what do you guys think now? Somebody's not breathing, but he's got a pulse and his pressure's okay. What would you eventually end up doing for him? Yeah.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have a great show tonight. We're talking about the St. Luke's Simulation Center. In case you're just tuning in, I'm joined by three St. Luke's medical professionals, Megan Augustine, Sandra Messick, and John Gillard. Thank you guys for being here tonight. It is so fascinating what is going on in the Simulation Center. I really almost can't believe that this technology exists in this day and age. So John, tell me a little bit about standardized patients, how they're used in the Simulation Center. What is a standardized patient?
So a standardized patient is basically actors that have been trained on projects to try to improve the interactions that our providers, APs, nurses, and physicians will have with patients and their families. An example would be maybe having some conversations with patients in the ER or with patients' families in the ERs about sensitive things or topics where they become scared and afraid and they can react very differently depending on the person. And then we basically plan out a sim where our physicians will go into the room with a family member or a patient, that's this standardized patient, and they will deliver bad news. And then at the end, when they debrief, the physicians and the nurses love to get the feedback from the standardized patients as far as what they perceived and how they were sort of processing the information that was being delivered.
A true simulation of a real life exchange that may happen and probably will happen at some point in your medical career. In addition to the standardized patients though, Sandy, you also have Sim Man and Sim Mom. Tell me who they are and how they're used.
Sim Man is pretty amazing. If you're a Star Trek fan and you think of the character Data, Data is kind of Sim Man. He practically walks and talks. He has vital signs. He breathes. He has lung sounds, bowel sounds. He can bleed. He can do all kinds of things. We thought that Sim Man was so important that he first arrived back in 2003 with the aid of the St. Luke's Auxiliary that provided some of the funding. We felt that it was that important. And I believe since then we've worn out the first SimMan and we've gone to a higher level of simulator.
Amazing. And what about SimMom? What does she do?
SimMom gives birth, and that's an amazing thing. And so we can put students in there for a birthing simulation, and we can simulate complications that students wouldn't normally see, thank goodness, in their clinical experience. Things like a postpartum hemorrhage or a placenta previa, things that we don't see a whole lot but we need to be prepared for, because when nurses are encountered with those situations in real life, time is of the essence and they have to act in a critically timely fashion.
And it used to be that really you had to be in practice for a certain number of years to see all of these things, and now with the Simulation Center you can actually simulate scenarios that you may not have seen for 10 years in practice. So with that, Megan, you've got a couple of cool things. So I want to make sure I say this right. The anatomage table and also the mobile sim center. So tell me briefly, what are those two things?
Sure. So the anatomage table is a 6-foot anatomy table that you can do dissections on. It's a 3D table. So there's 4 cadavers that are on the table between the ages of 20 to 60 years old. There's 2 females, 2 males. So if we look at one of the patients that are already on the table or one of the cadavers that are already on the table, there's certain pathologies that are unique to that patient. Take it a step further, you can have a surgeon come in, bring in that patient's scan, an MRI or a CT scan, import that onto the table, and then look at that in 3D. And if you think about how much technology has changed over the years, you look at the black and white images, but now we're looking at it in 3D. So you can rotate, you can dissect, you can, again, it goes back to cutting down on time that the patient essentially is under anesthesia. So it's cutting down, their risks.
I would think as people have the opportunity to see what it's capable of and work on it, there will be something that will be a continued investment in that work. What about the mobile sim center?
When I became the director, I had this great idea of building a simulation center, just like a lot of other places across the country, but I quickly maybe slapped myself in the face and realized that it's not going to work for the culture at St. Luke's, just because of how large we are and how spread out we are. So what better way to fix the problem or find a solution was to take the sim center and put it on wheels, and so then it's traveling. So now we've built this 34-foot simulation truck where it has a simulator on truck, so it has a SimMan ALS on the truck on a stretcher. You can fit up to 12 people on the truck. It also has the ability to do skills on the truck, so if you wanted to practice chest tubes, intubation, you have the ability to do all the skills that you would in a simulation center on the truck. In addition to that, it also has the ability to record. It has a full AV system. It has a control room. You have the ability to do the pre-brief and debrief on or off the truck.
It really is amazing everything that you've got going on in the Simulation Center, but we're not done because we're going to get some questions from our studio audience. Are you guys ready?
Yes. Ready.
All right, good. Stick with us. You're watching St. Luke's Health Now. Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our amazing panelists. We've really had a good talk learning about the Simulation Center, the technology involved, and how it benefits patients and our entire community. But now we're going to take some questions from our viewers. So up first, I've got a question here that says, what is a 3D printer and how is it used in simulation and in real-life medical situations? John, can you answer that?
Yeah, so the 3D printer is something that we commonly use in the Sim Center with Megan's team taking point, is that we'll go to the Sim Center needing to perform procedures on different anatomy, whether it be a neck, whether it be a chest, heart. Prior to the 3D printer, we were performing on objects that may look very fake. With the 3D printers, Megan, in the critical care arena, has been able to produce an entire neck for us, so we can put in central lines. She's been able to create a chest where we can put tubes in the different areas of the chest that'll ultimately, similar to what we said before, will save lives. Because these opportunities or these events don't occur very regularly, luckily, in medicine, but when they do, they're life-threatening. And if your providers aren't ready to perform this procedure and they're not fully competent and familiar with the technology, then you're likely not to get the best result. And I think what has really been a game changer at St. Luke's and with critical care and with all the different service lines is that the Sim Center allows us to save lives before we need to do it in real.
That's amazing. And you can see how the simulation center really benefits the actual patient. But Sandy, what about the community? How is this simulation technology benefiting our community?
We can take some of the simulation mannequins out into the community. We could do events at various sites and locations. Young people can have access to them. They can play with the mannequins. They can learn what we do with them. They can listen to heart sounds. They can put on a stethoscope and listen to bowel sounds, heart sounds, lung sounds. And we think that it really does stimulate their interest in the health sciences.
All right, Megan, this question is for you. Are there any opportunities for people in the community to tour or participate in the simulation center?
That's a great question. I was actually waiting to piggyback off of Sandy's because, yeah, we do tours on a regular basis. It's fun for us and it's fun for anybody in the community. It doesn't matter what age you are. So if anybody does come in, we will run them through a simulation. And we do give them the opportunity, to talk to these simulators. They do talk back. And like Sandy said, they get to listen to the heart sounds, listen to lung sounds. They get to feel for the pulses. So we want them to have that hands-on opportunity. And whether we're, doing it in our center or whether we're going out into the community, into the schools or to the Da Vinci Center, whether we want them to get practice, with CPR and just, we're not certifying them in CPR, but we want them to know the basics, what to do first, when to call for help, where to check, for if they're breathing, do they have a pulse, and then, where do they, do the chest compressions, how far down do they do the chest compressions. In a matter of seconds, just that little bit of information, even though they're not certified, can truly save, a life and certainly one of their loved ones. So for them to have that hands-on opportunity, again, in that safe environment and have fun doing it is a win-win for everybody.
Well, it's certainly comforting to know that not only are all of the medical professionals at St. Luke's being trained in a simulation center, but that our community has access and we're exposing families and young children to all the wonderful things that medicine can do. So thank you all for being here, for answering our studio questions. Thank you so much to our audience for being here with us tonight and giving us those great questions. For more information on the Simulation Center at St. Luke's University Health Network, please visit their website at sluhn.org or call InfoLink at 1-866-St. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.